There aren't so many questions necessarily on autonomy versus beneficence versus non-maleficence and justice. Um, but it's always something that whenever you're put in a subjective position, you have to consider all of them when you go into your answer. So autonomy is always the first one you need to consider. The patient has a right to decide, what's right for them. They can do what they want. Beneficence is just like it says, what's in their best interest. Non-maleficence is, do no harm, don't be a dick. And justice is probably the weirdest one to think about, but it's just doing what's right. At least it can be summarized in that. And here they talk about equitable treatment, not equal treatment. You wouldn't treat a 5-year-old the same way you treat a 40-year-old and vice versa, hopefully. All right. So informed consent, this is a big one, and I've seen a lot of questions on informed consent, specifically on you didn't give them options that they then found somewhere else. So this includes options that even you wouldn't particularly go for or something. So this can be, for example, there's a new drug on the market or something, and you don't mention this new drug, and then the patient finds out about it, and you had already known about it. You can get into some trouble doing stuff like that. So when is informed consent not necessary? Well, you can think of most of these examples off the top of your head. Emergency situations, like someone comes in and they're just gushing blood from everywhere and they can't give. Well, then yeah, you do an emergency transfusion, or you do what you got to do, unless there are some very specific situations, like they have a bracelet that says, "Hey, don't do this. Don't give me any life-saving whatever." If they're legally incompetent, if it's determined that they can't actually make decisions for themselves, maybe they're severely mentally retarded, maybe they're delirious or something, maybe whatever. And then, of course, waivers, any sort of legal document. It can be a paper, it can be something, a recorded testimony, it can be a video, it can be. Therapeutic privilege is the one that people don't typically think about. And I've only seen a couple of these, so I don't know how high yield it is, but it's still important to understand what it is. So when can withholding information be good? Well, for example, someone comes in and they say, damn it, doctor, do I have a fever? I swear to God, if one more person tells me I have a fever, I'm gonna kill myself and every last baby in this pediatrician's office. Whoa. Okay. In that sense, you don't have to tell the patient, absolutely everything. You don't have to say, well, yeah, you got like a 102, buddy. Like, what do you want? There are obviously some cases where, you use clinical judgment and you say, well, I don't want to set this ticking time bomb off, so I'm going to play it cool a little bit and find another way to do it. Now, they probably won't ask you a question like that severe or anything, but keep it in the back of your mind where sometimes there are some exceptions to informed consent. And consent for minors, sex, drugs, rock and roll. They're not going to test you on the age thing, okay? They're not going to say, oh, in some states in the United States, it's 16 years old for consent, but depending on blah, blah, blah. They're not going to do stuff like that. They're not going to try and get you because it's a 17-year-old, okay? So you don't have to worry about that. But what they will ask you about are these cases: traumas and emergencies, substance abuse, and then anything regarding sex, contraception, pregnancies, STDs, birth control, any of that stuff. And the answer is always going to be you keep it between you and the patient, unless there's something extraordinary going around. Okay. So there's no reason to violate these things unless there's a real extraordinary case. The exception, of course, that I was talking about for emergency situations where someone has something on their wrist saying, hey, don't transfuse, would be if it's a minor. You cannot withhold life-saving treatment from a minor, no matter what. For religious reasons, for holier-than-thou reasons, you can't do it. There's like a famous question that everyone always reads through, and it's, you've got a mother and a child, both Jehovah's Witnesses, both have a wristband that says, do not transfuse blood. And they've gotten into this awful car crash, and they're losing blood at like a sow pisses. And so, it's just the mother says, hey, don't transfuse me or the child. So what do? You don't transfuse the mother, but you absolutely have to transfuse the child. You cannot withhold first-line emergency treatment for minors. Okay. Again, consent for minors here, they're not going to get you on, different states have different rules about abortions and consent for blah, blah, blah. They're not going to get you on age stuff like that. And they're not going to get you on, what's the difference between Connecticut and California? They just want you to know for things like pregnancy and STIs, for things like drug use, withdrawal, for emergencies, for any sort of trauma, you're allowed privacy as a minor. That's what it is.